Empty head. So is that better? All right. So before Michelle takes over, I just wanted to make a couple of quick comments. One is one of the things that struck me in listening to that last session, and Wayne alluded to this, is both the VA and DoD has developed a number of programs that are highly relevant conceptually. They deal with different circumstances and different populations, but content-wise and from a subject matter point of view, there really is a lot of overlap. And so one of the things that I would hope is that we could think more about cross-fertilization or bringing some of the, just as with the burn programs that you talked about, bringing some of these communities together. The logistic thing I wanted to just note is for the speakers and the moderators, there will be a session at 5:30 when we conclude this last session over on the, I guess I call it the breezeway. It's on the 3rd floor of the education building, which is right next to us, to just debrief a little bit about today and tomorrow. And to have some refreshments, but so I just wanted to make sure that for the folks who are still here that you know, and we'll think about that in case you were thinking about leaving early or not. And so Michelle, one of the points that has been made in a variety of ways by a variety of people has been the paucity of data and the difficulty in doing research in this subject matter. So we, in thinking about putting this program together, the planning committee was cognizant of this, and we thought we would spend a little bit of time specifically focusing on some of the challenges in doing research. So with that, I will pass it off to Dr. Bell.
Hi. Oh, now you know who I am. I have water, thank you. Thank you. So we're almost at the end of the day, and I like to stay on time, so it's going to be okay. So this is a shorter session, but as was mentioned in the planning of this workshop, we've heard from so many different topics, and as was mentioned at the beginning, there are more topics than we could fit in this program, even in 2 days. But you know, there's so much valuable research that happens in this, but as a researcher myself who has done some of the early work on wildfire, air pollution, exposure, and health, we found that there are a lot of challenges in just estimating what are people's exposure to wildfires. So just as one example, I was working with wildfire modelers, and they were saying, you know, our models are so great, they're really validated, we really know where the wildfires are. I'm like, that's great, but from a population perspective, I need to know where the smoke is. So can you validate the wildfire smoke instead of the wildfires? Well, it turns out the model still worked very well, but that was just an example of some scientific challenges that we had to get over. So just for this shorter session, we thought it'd be great to hear from some people, and you've heard from all of them before, so I'm gonna save time in terms of introducing them. And just let them talk about some of the challenges and limitations they have in terms of just research or thinking about how you estimate wildfire. And in the title here, it says wildfire smoke exposure research, and that's probably not the best title. That's because that's what I looked at as wildfire smoke. But I want to give the opportunity to our panelists to feel free to talk about any challenges and limitations they find in wildfire research, whether it be for smoke or water quality or any other relevant topics. And we'll start with you, Colleen. Thanks.